We can hold it. All right. Welcome back and still on Morning Ride, Friday's edition. Today we are celebrating the National World Diabetes Day, and I told you in my opening that we were going to have a doctor who will come here and talk to us about diabetes because health is wealth, and you need to know a whole lot about diabetes. People just commonize it and think that, oh, it's not that serious of a sickness, but we're here to let you know that you need to really, really take care of your health, and you need to know a whole lot about diabetes. And on that note, I'd like you to join me as I welcome Dr. Victor Oti. He is a doctor with the Federal Medical Center, Asaba. Good morning, doctor.
Good morning. Good to see you.
Good to have you.
Thank you very much.
All right. Please, I really need to be having this kind of doctors take care of patients. When you have this doctor assigned to you to take care of you, you get well by force. What is diabetes when Dr. Victor is there?
Thank you so much.
All right. So we're looking at diabetes now. What is diabetes? For the benefit of those that don't know what it means, just explain to us what diabetes is.
Okay, diabetes is a syndrome. So what I mean by a syndrome is that it is a collection of different things. But on a very general and very basic note, diabetes is a lot of sugar in your body. So much that the sugar is available in your body, but your muscles, your body tissues are not making use of the sugar, right? So it's in your blood, right? But it's not getting into your tissues, into the cells. So think of diabetes as excess sugar, right? It's excess and it's not going into where it should go in your body. And then because it's in your blood, it begins to cause a lot of trouble, and then it spirals into a lot of things. So that is what it is pretty much.
All right. Just simply put, diabetes is just excess sugar in the body that is occupying space and not doing anything or going to the tissues that it's supposed to go to.
Exactly.
Now, when you see someone that has diabetes, how would you know? What are the symptoms of diabetes?
Okay, there are a lot of symptoms, but usually the diagnosis of diabetes is made out of exclusion, when you rule out a lot of things. But basically, we have a lot of symptoms, like the person will get easily thirsty, the person will go to ease himself a lot more, the person can lose weight, and there's several other factors, And diabetes sometimes is not diagnosed until it gets to its very serious later stages, and so that person can begin to progress into some very severe forms of diabetes where his wounds cannot heal, right? And when he's having pain, and it can progress to several heart defects and a lot of that even affecting the kidney, but the best way to make a diagnosis of diabetes is to get checked out, right? Is to get checked out. Usually people we diagnose diabetes, we stumble upon the diagnosis, when someone presents to the clinic and then you begin to run your tests, you now find out that the person is diabetic, so the best way is to just make a diagnosis, to take a test for diabetes.
Okay. And like some other sicknesses, does diabetes have types? If yes, what are the types of diabetes we have?
Okay, there are several types of diabetes. There is a type 1, there is a type 2. The type 1 is usually, they call it the juvenile kind, usually common amongst children. It can be found in adults, and its own scenario is different. There is a type 2, which is the most common one. There is gestational diabetes, which you see amongst pregnant women, There is also diabetes insipidus, which is another kind of one. So there are different kinds of, diabetes, all right, and it can present in different forms.
So these diabetes types that you just mentioned, which is the serious one? Which would you say is more dangerous to health?
Okay,
That has gone beyond managing.
every one of them can be managed.
Oh, okay,
Right? Every
okay,
one of
fine.
them can be managed and taken care of.
Okay.
You see, but diabetes type 2, which is the most common one, which is the one adults have to deal with, is very serious because sometimes it is subtle and it begins to progress, keeps progressing till you stumble upon the diagnosis or till the symptoms get really severe. So I'll say that diabetes type 2 is the most serious because of its subtle form of progression. Yeah.
Diabetes type 2 is the most
Yes.
serious.
So what
Okay,
happens?
so what is the risk factor now? You know, that is, okay, what's the risk factor for developing diabetes type 2?
Okay, several risk factors abound, one of which is lifestyle. You know, sedentary lifestyle, you're not going around, inactivity, obesity, right?
Ah.
Fats, or your diet. And then it also has a hereditary component. What that means is that if it is in your gene, it's in your gene, right? There are people, not every obese is diabetic, right? So there is a genetic component, there's a dietary component, there's a lifestyle component, and there's an environmental component to the type 2 diabetes.
Okay. Well, so far so good. We are getting there. But is it something that someone needs to be scared of? Like, if not treated, does it actually kill?
Yes, diabetes is serious. Diabetes is serious. You should not be scared, but you should be interested. You should be very interested. Diabetes can progress into very severe forms, and the problem of diabetes is that it can lead to other things that just put you at a bad place, at a bad position health-wise. So
Okay.
it is important that if you are seeing signs, right, you should go to hospital and you should get a glucose test, and know what is going on with your body with regards to your sugar level. It's important. It's serious.
Okay, so
Yeah.
what's complications? Because you talked about it gives rise to other kinds of
Yeah.
sicknesses. Now, what complications can arise if diabetes is not properly managed?
treated. It's a lot. It can affect your heart. It can have some coronary complications, and where you can have a myocardial infarction, where your heart begins to have issues.
Okay, Mario, but
It just affects your heart. That's what
Okay.
happens. Think of it as a part of your heart not getting enough blood supply, and then it shuts down. Can affect the brain. Can have a
diabetes
transient-
affects the brain?
Yes, it does. It does. People can have strokes, and their transient ischemic brain disease, or their transient disease, is as a result of diabetes, right? So it can cause stroke. It can cause. It can affect your heart. It can affect your kidney. It can affect your eyes, what we call diabetic retinopathy. It can affect a lot of things. Several people, when they walk, you find that when you walk, you can't walk for a long time because when you walk, your leg begins to pain you. Some of this is from, it can be as a result of arthritis or something like that, but some of them is as a result of the effects of diabetes on your vessels and your nerves. So it can really, it's really serious.
It's getting scary. You
It
said
is.
we shouldn't get scared, but we should get interested.
Get interested, yeah.
Okay, so that's the same. Diabetes can affect the legs, not arthritis,
Yes.
or they work together. Because I know that arthritis affects the legs.
Yes, arthritis affects the
Or-
bones and the joints, yes,
Okay.
and extremities and the legs most commonly.
Okay, so
But
that's to say diabetes actually gave rise to arthritis.
no, not
Okay, I
necessarily.
want to know.
Not necessarily. Okay, so what diabetes does is that because of its sequelae of progression, it can affect your blood vessels, and your blood vessels are unable to supply blood to where it should go. So if it's unable to supply blood to the extremities, your foot, your toes, and all of that, those muscles are starved of blood, of glucose, of energy, and they begin to react, and you have that pain. It can also affect your nerves, right? So your nerves are unable to transmit impulses, receive and send impulses. You see that, and that will give rise to the issues with your extremities, your hands. That is why sometimes you see when people have severe forms of diabetes, they have wounds on their legs, and it
Yes, it
cannot
refused to
heal,
heal.
right? Because
Yes.
all that is supposed to supply the component that's supposed to facilitate the healing are not getting there. You see, because of the effect of diabetes on the vessels and the nerves. So that's different from arthritis. Arthritis is a bone issue.
Okay.
You know, pretty much it affects your bone, and then it spirals into that. Is its own cascade.
its
Yeah.
own.
You know.
Okay.
So, but I mean, they're all serious
Yes,
things.
they're all serious.
to
Now let's
think
talk
about.
about the eyes. You said diabetes can affect the eyes. In what way? Does it cause total blindness or blurry vision, or what exactly does it do to the eye?
Okay, because of the nerve supply to the eye, you know, because diabetes is affecting all the vessels, it's affecting all the nerves. It affects the nerve that we call the optic nerve that supplies your eye. So when it does that, it can present with different things. It can present with blurry vision, it can present with pain, it can present with cloudiness, you know. But that is not to say that if you're having that, it's because of diabetes, right?
Okay.
That is why it's important that you go in, see an
Check.
ophthalmologist and get it checked out.
Okay. Now you talked about type 1 diabetes
Yes.
and type 2 diabetes. Now, how is type 1 diabetes different from type 2 diabetes?
Okay. All right. So in type 1, what happens in type 1 is that somehow your body begins to fight the cells that produce insulin. So what is insulin? Insulin is the hormone or the substance in your body that takes sugar from your blood into your muscles. So, but somehow your body begins to fight the cells that produce insulin. So it's autoimmune and it destroys it, and your body can no longer produce insulin. But type 2 is that you have insulin, right? You have insulin. Insulin is being produced. But your cells that are supposed to receive the insulin are insensitive to insulin. All right, so insulin is being produced, but your cells are not responding to insulin. Your tissues are not responding. So what happens is that your body is forced to produce more insulin to try to help, you see. But the problem is that your cells are not taking it in. And then what now happens is that the pancreas, which is responsible for producing the insulin, now begins to fail because it's trying to produce a lot of insulin. Although the insulin is not doing its work, it continues to produce and then it begins to fail. So in type 1, the cells that produce the insulin are being attacked. In type 2, insulin is produced, but it's not doing its job because the cells are not allowing it to do its job. Yeah.
Wow. Diabetes is really deep.
It is.
So what treatments now would you say, or would you recommend? What are the treatment options for the type 1 diabetes?
Okay, you see, they are different, but they are around the same things, the same issues of insulin and sugar and all of that. So I'll just say that the person should just come into the hospital and see the doctor. All right, it's a lot of things. Management of diabetes will stem from lifestyle modification to diet modification and to targeted therapy when we begin to give some drugs. All right, some drugs that help the production of insulin, some drugs that will help to allow your cells taking insulin. You see that? So it's a lot of things. It's dependent on the situation, the peculiar situation. We look at you, we see what is going on, and then we address it.
Okay. So as we celebrate the World Diabetes Day today, we have a theme, I suppose.
Yeah.
So what is the theme for this year's celebration?
Okay, this year's celebration, the theme is diabetes across all ages, right? Across all ages. So we are looking at, how diabetes affects people across all ages, and it's important for everybody, to be informed on this subject and to know their state. All right. So if you're listening to us this morning, this is your cue to get into a clinic and ask questions. Talk to a doctor about it and get tested, okay, and see what is going on.
Okay, get tested and see what is going on. Know your diabetes status. Okay, so what's lifestyle? Because I want to believe that our lifestyle also attributes or also tells or contributes to what we pass through health-wise. So what lifestyle changes can help manage type 2 diabetes? For those that have type 2 diabetes, what lifestyle changes do you advise that they should emulate?
Okay, exercise. Exercise is very important, right? Exercise helps your muscles to be able to take in, to be able to more sensitive to insulin. So exercise. If you are the kind that sits on your chair all day, you know, sitting on your computer, or the kind that likes a soft life, that is also good. But try to engage more physical activity. Also, diet modifications. Avoid refined carbohydrates. You know, take a lot of protein, take a lot of vegetables and fruits. You see, and all that. So exercise. You see, and then your diet is important. Avoid alcohol. You know, and stick to natural foods. Right. Yeah, stick to natural food. Reduce intake of carbohydrates. Reduce intake of packaged foods. You know, all of this refined stuff, and just stick to fruits, vegetables, whole proteins, and maybe carbohydrate, natural carbohydrates here and there. But make sure your diet is whole, and then make sure you engage a lot of physical activity. Hit the gym, get a subscription, begin to run about, begin to cycle, if you can swim, whatever you have to do to keep your muscles active and your tissues up and running. Yeah.
Okay. Okay, regular exercise, and a good diet.
True.
Yeah, that's
True.
all really okay.
True.
Now you talked about gestational diabetes, and you said it occurs more in pregnant women.
Yes.
Yeah, does it go away after pregnancy?
Sometimes it does, but sometimes it does not. Sometimes
Wow.
it can also spiral to what we call eclampsia, you know, which is also very serious. It occurs around the 24th week to 26th, 27th week, you know. Basically, it's important that a pregnant woman should go to the hospital, see the doctor, you know, and they run all these tests, and then they can now take it from there, look at it from there.
Okay. Well, this is not to get our pregnant women scared.
No,
but
surely
it
not.
can be managed. And good thing you said some goes away after pregnancy.
Yeah.
Yeah. Okay. Now, you talked about exercise. Now let's talk about food. What are diabetes-friendly foods that you will advise one can take, like those suffering from diabetes? What are the kind of food they can take,
Okay.
and they should avoid as well?
Okay. I would advise you to try to avoid anything refined. Try to avoid
Carbonated food.
Packed foods, you know. It's a lot. I don't want to call brands, you know, but try to avoid it. You know, stick to fruits, vegetables, things that can decay, things that are organic, right? Things that can be worked on by bacteria, you know. Don't just buy things that are packed and canned. Then if you are eating rice, you don't have to, sometimes you're advised to avoid it, you know. But if you must, you must, you know, don't take a lot of it, you know, and then you have to augment it with a lot of fruits and vegetables. You see, there is a lot I can mention or not mention, but what I would say is stick to vegetables, fruits, you know, protein, you know, and that is it, pretty much.
Okay. Now I know about insulin, you know, a little bit. Okay, but now I want to just ask, how does it work? How does insulin work? And what are the different types we have? Because I think I overheard somebody sometime who said he has diabetes and he was given insulin to always administer to himself. So tell us more about that insulin stuff.
Okay, so insulin. So when people have that diabetes, either when the cells are not producing enough, or when the cells are producing and the body is not taking it in. While we manage them, there are some drugs we give, and some of them is insulin, a physical and artificial form of the natural analog that is produced by the body. All right, so they come in different brand names, you know. So, and then if you notice, people that have diabetes, sometimes they are given those things and they inject it. Some of them inject it on their skin and all of those things. So how it works, you know, usually sometimes when people, because they are diabetic, because their sugar levels are very, the sugar levels are in a precarious position, they can spiral when they can have a high sugar level in their blood, and there are times when they can have a very low sugar level in their blood. So in those times, you know, especially when they are very hypoglycemic, when the sugar level in their blood goes really down, and that is bad. It is bad that your sugar level goes bad because your brain makes use of glucose.
Yes.
Your brain makes use of glucose. Your muscles can find a way around it by producing their sugar from some other ways, but your brain works with glucose. So it is important that the glucose level in your blood is good, it's appropriate for your brain. So what happens is that in those kinds of times, patients are now given those medications, and they have to administer the insulin. You see, but I'm also being very careful because it's not a general rule for everybody. This is very tailored to the specific patient needs. Okay, so depending on the position where the person is in his disease progression and what we aim to achieve, we now know what to administer. Sometimes we don't give insulin; we give other forms of, you know, of drugs that help to do some other things. You know, so yeah, sometimes patients have to take insulin themselves.
Okay, all right. So now there are some myths and misconceptions about diabetes. So I'm going to run them one after the other, and then you throw more light on it. Now, people say only overweight people get type 2 diabetes. Is that true? Is that true or false?
No, it's false.
Oh.
It's false.
Okay.
It's false.
Okay.
It's a risk factor, but that does not mean that it's only for them.
Okay.
Yeah.
Okay. All right. So, if you have diabetes, you can't eat sugar. That's what some persons say. If you have diabetes, you can't eat sugar. Like you are banned totally from eating sugar.
You know, we have sugar. We have refined sugar, but we have sugar in our foods, right? We have sugar in our foods. You can, but you really have to watch it. There is a very strict control over it. So I don't want to say here that you totally
stay
don't
away.
have, because I mean you find it in everything we, you know, even in our fruits we have fructose, which is some form of sugar. You see that? So you don't stay away totally, but there is a very strict restriction to what you can take in.
And well, some persons say those sugar we find in our fruits and there's this dates. That they are natural sugar and they are good for the body.
Yes.
Even overdose of it is not bad. Is that true?
Yeah, well.
Overdose of dates.
Of dates.
Yes.
Who am I to come against God's question? You see, but in all of this, especially since
sugar cane as well.
I have a feeling you like sugar cane.
Oh yeah, I do.
All right. So well, in situations like that, especially for someone that is diabetic, it's important to apply caution. Even in the natural things that God has given us, you see that it's important to also apply caution. But yeah, like I said, you can't avoid sugar.
Yeah,
you find it in everything, many things.
Yeah. All right. Thank you for that. Well, some people say insulin cures diabetes. Is it true? Does it cure diabetes or it manages diabetes?
Most times it's a management. Usually diabetes, we manage it long term.
Okay. All right. Another myth says type 2 diabetes is mild.
It's not mild. It's just subtle in its progression. You see, unlike other forms, you see that it's more subtle.
Okay.
It's more subtle. Many people don't know they have it. right? So not necessarily that it's mild, it's just that it's subtle in its progression.
Okay. All right. And so another myth says only old people get type 2 diabetes. Is that true?
No.
So children
There's
can
been
get...
reports that people from 25 years have also come down with type 2 diabetes. Remember that there is a genetic disposition.
Okay,
so especially for someone who is predisposed to that, and then the person worsens the situation by living wrongly, eating wrongly, and several other things, it can exacerbate the progression of type 2 diabetes. So it's not restricted to old people.
Okay.
Yeah.
Now, they say you can stop medication once sugar level normalizes. Like someone that has diabetes and the sugar level normalizes, the person can stop medication. Is that true?
No.
You have to continue?
You are advised to take your medication regularly, show up in the hospitals, because you may think it's beyond sugar level,
Yes.
right? It's beyond the sugar level dynamic, right? So, and even when it's normalized, you keep taking and then keep relating with your endocrinologist to see. Yeah.
Okay. Well, some people fear that diabetes is contagious. Is it?
No,
contagious.
It's not.
When you see someone that has diabetes, you run away from the person.
No, it's not.
Okay, you just said
it's not contagious.
it's not contagious.
Yeah.
Okay.
It's not.
Well, eating too much fruit causes diabetes. Okay, you just answered that. And you talked about different types of diabetes. Is it all types of diabetes that needs insulin?
No, not necessarily. Not necessarily, right? But all of them have something to do with the availability of sugar and all of that, but not necessarily all of them are treated by insulin shots.
Okay. And someone says exercise is dangerous for diabetic patients.
Exercise is not dangerous for diabetic patients. It's beneficial for diabetic patients. In moderation, right? But exercise always outweighs the benefits, always outweighs the risks. If in any way, it's always beneficial.
Okay.
Yeah.
Is it to do too much of exercise or not much of
Just
exercise?
adequate. You don't have to train like you're going for war, but you have to do one or two. You have to apply yourself, right? If you can hit the gym 4 times a week or 3 times a week, as a lady, you can get a skipping rope and skip for 30 minutes. You can do a 30-minute morning run. You see that you can get a dumbbell, 10 kg dumbbell in your house and lift it. Something to just keep you up and running.
Okay.
Something to just consistently do. Yeah.
Okay. All right, let me go back again to gestational diabetes in pregnant women.
Yeah.
Now, when the women have this diabetes, does it affect the child in their tummy? Does it affect the baby?
No. Well, when someone has diabetes, it can now exacerbate, lead to complications, and the complications can now have widespread effects. So when gestational diabetes gets serious and progresses, preeclampsia, eclampsia, it can affect the baby in the long run. You see that it can even lead to stillbirth. You see that, and all that. So it can spiral into a lot of things. You see that, yeah. So it has potential in the long run to affect the child.
The child.
Yeah.
Okay. All right. I think I have touched everywhere. Except there are other parts you think I haven't touched that you want to let us know.
Not necessarily. Well, it's important that you know about your sugar levels.
Yeah.
Several of us have never taken that test. So if you are listening to us now, this is your cue to go into the hospital, go to a clinic, see a doctor, and get tested. There is the fasting blood sugar that you take in the morning before having breakfast, and there is the random sugar level that you take if you've had breakfast. So go in, get tested, and know your status. Many people are walking around, they are pre-diabetic, they are diabetic, and they don't know. It's important that you go check it out.
Okay. You talked about going to the hospital to get yourself tested. Is there no kit you can have in your house to check your status yourself?
Yes,
check for your blood level yourself.
There are kits that you can just take, and they won't even necessarily require that you see. But why it's important to go to the hospital is what comes after your test.
Okay.
You see, so you will have someone to give you professional advice. You have someone to tell you what to do, what to keep doing, and what not to do.
Okay.
You see that, so it's important that you go see a clinician for that.
Okay.
Yeah.
Thank you so much,
so
Dr.
much.
Victor
Thank you for
Oti.
having me. Thank you.
See, he has told us everything and more that we need to know about diabetes. And so as we celebrate the World Diabetes Day today, make sure you go to the hospital and get tested. And also, for the myth that has been going round saying that diabetes is contagious, you just heard from him that diabetes is not contagious. Okay, so stop avoiding people and stop the stigmatization. Don't avoid people that have diabetes. You cannot contact it. It's not like the other, it's not like hepatitis B that you can easily contact, you know, and it's not like HIV that you can contact when you have blood interaction with the person. So don't fear, don't be scared. The only thing you should be scared about is, is your sugar level high? Have you gone to the hospital to get yourself tested? Do you have the kit at home so you can check every now and then? Okay, it's very important to know your status. So diabetes is not contagious at all. It is not an infection that you can easily get. And also you need to check what you eat. Check what you eat. It's very important. Avoid excess fat. Avoid canned food. Some persons cannot do without canned food. They want to take canned food every now and then. Avoid it. Okay, avoid excess sugar. You can take the natural sugar, like the doctor rightly said. Natural sugar is good, but even though it is good, too much of everything is bad. You cannot say, okay, date is natural, sugarcane is natural, and then you want to eat a whole truckload of it. Too much of everything is bad. Then regular exercise. You need to exercise regularly. It's very important. Like I don't even understand why someone will wake up in the morning and not do the little indoor exercise in the confine of your room. Even in your bedroom there are little indoor exercises that you can engage in, you know. So do those exercises and live a healthy life. So I am urging you to go out there now, as you have heard, go out there right now to the clinic and get yourself tested. Say no to diabetes and live a healthy life. Once again, I would like to say thank you so much, Dr. Victor Oti. It's a pleasure having you here today.
Thank you so much. Thank you.
Okay, so we'll drop that now. We'll go on a quick break. When we return, it's the time to look at our dailies. Let's see what story is making rounds.